Over 120 million people worldwide rely on metformin to manage their diabetes. But what if it's secretly causing you more harm than good? While it helps control blood sugar, many people don't realize the medication can trigger side effects that disrupt everyday life and long-term health. One of these side effects is so common that up to 30% of long-term users may develop it, and it's not something your doctor might mention. In this video, I'll reveal the 3 most critical metformin side effects every diabetic needs to know, starting with the one that could be silently damaging your nerves. So stay until the end. Have you ever felt that unsettling sensation in your stomach right after taking your medication? That nagging discomfort that seems to follow you, whether you're trying to enjoy a meal or just get through your day? It's something that seems harmless at first, but can gradually become overwhelming. What if I told you that this common side effect isn't something to just brush off? What if it's more than just a minor inconvenience? This side effect doesn't just happen to a few people. It's something that impacts nearly a third of people taking diabetes medication. Gastrointestinal distress, which includes nausea, bloating, and even diarrhea, is one of the most frequent side effects of metformin, a widely prescribed medication for diabetes management. It's so common that up to 30% of people on metformin report experiencing some form of GI discomfort. It might start off with mild bloating, but as time goes on, the discomfort can intensify. You might find yourself avoiding certain foods, skipping meals, or even staying home because you're afraid of an upset stomach. The problem is, this isn't just about discomfort. It can start to interfere with your life in more ways than you might realize. Everyday activities like going out to eat with friends or spending time with family could become harder and harder. If you're already feeling frustrated with your diabetes management and now dealing with GI issues, it's easy to feel like nothing is going your way. But why does metformin cause these issues? It all comes down to how the medication interacts with your gut. Metformin works by reducing the amount of sugar your liver releases into your bloodstream and helping your cells become more sensitive to insulin. While this is great for managing blood sugar, it also affects your digestive system. The drug increases the amount of lactic acid in the intestines, which can lead to stomach upset. But it doesn't stop there. Metformin also alters the balance of good bacteria in your gut, which can lead to bloating, gas, and even diarrhea. The symptoms might seem mild at first, but they often worsen as time goes on, causing more and more distress. If you've been using metformin for a while, you may notice that the initial discomfort you experienced when starting the medication is now a constant presence. Here's the part that many people overlook. These side effects don't just affect your stomach. They can impact your overall health in ways you might not be aware of. Did you know that metformin can also interfere with your body's ability to absorb vitamin B12? That's right. Long-term use of metformin can lead to a deficiency in this essential nutrient, which is necessary for nerve function, red blood cell production, and even energy levels. Studies show that up to 30% of long-term metformin users develop a vitamin B12 deficiency, which can lead to symptoms like fatigue, weakness, and nerve damage. What's even more concerning is that many people don't realize they have this deficiency until the damage is already done. Nerve damage can lead to numbness or tingling in your hands and feet, making it even more difficult to manage your diabetes effectively. This is why it's crucial to regularly check your vitamin B12 levels if you're on metformin for an extended period of time. But there are things you can do to minimize these digestive problems. If you're just starting metformin, the key is to begin with a lower dose and increase gradually. This gives your body the time it needs to adjust, and it can help reduce the risk of gastrointestinal distress. For those who have been using metformin for a while and are experiencing GI issues, it might be worth discussing other options with your doctor. There are extended-release versions of metformin that may cause fewer digestive problems. And don't forget about vitamin B12 supplements. Taking them can help replenish any deficiencies caused by the medication, and that could help improve your overall health and well-being. But even with these adjustments, some people still struggle with persistent gastrointestinal problems. The good news is that there's another side effect you need to be aware of, and this one could be far more dangerous than a simple upset stomach. Let's dive into what happens when the side effects of metformin go from mild discomfort to something far more severe. The next side effect we're talking about is one that could pose a serious threat to your health if left unaddressed. What if your medication is silently putting you at risk of a life-threatening condition? You've probably heard of it, but it's much rarer than the digestive issues I just mentioned. Lactic acidosis is a rare condition, but when it happens, it can be deadly. You might be thinking, how could this be related to metformin? It's all about how metformin affects your body's ability to clear lactic acid. This buildup can cause severe issues, and I'll explain just how dangerous it is. But first, let's dive into how this condition develops and how to spot the warning signs before it becomes a serious issue. Stick around, because what comes next could save your life. Before we move on, I'd love to know where you're watching from. If you're a senior looking to naturally ease health problems, make sure to subscribe to Knowhow and turn on the notification bell. And if this content helps you, type 1 in the comments. If not, type 0. I want to keep improving for you. You've probably never heard much about lactic acidosis unless you're dealing with a serious health issue. But let me tell you, this rare condition is one of the most dangerous side effects that could potentially be linked to metformin. It's not something that most people expect or are even aware of, yet it's a threat that is real and frightening. Metformin is known to help control blood sugar levels, but lurking underneath the surface is a potentially life-threatening risk. Now, don't let the rarity fool you. When lactic acidosis does occur, it's serious, and it can escalate quickly. What does this mean for you? Let's break it down and see why this side effect should not be overlooked. Lactic acidosis is something that most people associate with extreme health emergencies. When it occurs, it's not just a matter of discomfort. It's a matter of your body's ability to cope with it. This condition occurs when lactate builds up in your bloodstream faster than your body can clear it. For people on metformin, the medication can reduce the body's ability to remove this lactate, and it starts accumulating in the system. You may not feel the effects immediately, but over time, this can become a real concern. What's more alarming is how little time you have to respond if you experience the symptoms. Let me paint a picture for you. You've been managing your diabetes with metformin, keeping your blood sugar in check, and suddenly, you feel more fatigued than usual. Maybe you're experiencing unexplained muscle pain, feeling short of breath, or even noticing a sharp drop in your blood pressure. These aren't just typical side effects of medication. They are signs of something much more serious. This is lactic acidosis setting in, and it could become life-threatening if you don't address it immediately. What makes this so concerning is that the warning signs can be subtle at first, and many people don't recognize the connection until it's too late. The fatigue and muscle soreness are often chalked up to other causes, but the truth is, this could be your body telling you something much more urgent is happening. And it gets worse if these symptoms are ignored. The effects of lactic acidosis can quickly worsen, leading to severe complications like organ failure, especially if the accumulation of lactic acid continues unchecked. For this reason, you cannot afford to ignore any unexplained symptoms, no matter how mild they seem at the start. It's important to remember, though, that the risk of developing lactic acidosis is still incredibly low for most people using metformin. In fact, studies show that only about 1 in 100,000 people taking metformin each year will develop lactic acidosis. This rarity doesn't make the risk any less dangerous, though. The issue lies in the fact that many people with no symptoms or previous kidney or liver problems still remain unaware of the possibility of this rare side effect. It's so important to stay vigilant and aware of any changes in your body, even if you don't fit into the high-risk category. Kidney problems are one of the key risk factors when it comes to lactic acidosis. Your kidneys play a vital role in removing lactate from the bloodstream. So if they aren't working properly, the lactate can't be cleared as effectively, leading to a dangerous buildup. That's why doctors are especially cautious about prescribing metformin to people with kidney disease or dysfunction. For those with healthy kidney function, the risk of lactic acidosis is incredibly small. But don't take that as a free pass to ignore the signs. Even without pre-existing kidney issues, metformin can still lead to lactic acidosis if not monitored properly. The risk is elevated when other factors come into play, such as liver disease or excessive alcohol consumption. A major study published by the American Diabetes Association found that lactic acidosis occurred more frequently in individuals with impaired kidney function. This discovery has led doctors to take a more careful approach when prescribing metformin, particularly for people with any degree of kidney issues. If kidney function is compromised, your body simply can't handle the drug as efficiently, and the risk of lactic acid buildup increases. That's why it's essential to have regular checkups to monitor kidney function if you're on metformin for long-term diabetes management. But what happens if you're one of the lucky ones without any kidney or liver issues? Does that mean you're in the clear? Not necessarily. The rarity of lactic acidosis in healthy individuals doesn't mean it's impossible. It's still a risk you need to be aware of. And even though it's extremely rare, the symptoms are something you shouldn't ignore. If you experience persistent muscle pain, unexplained weakness, or shortness of breath, seek medical attention immediately. These could be the early warning signs of lactic acidosis, and early intervention could save your life. So, if you're on metformin and you experience any of these symptoms, you should never brush them off. Yes, lactic acidosis is rare, but if it does happen, it can cause irreversible damage and put your health in immediate jeopardy. That's why it's crucial to be proactive and take action the moment you feel something is off. When it comes to your health, it's better to be safe than sorry, especially when dealing with something as serious as lactic acidosis. But don't think the risk is limited only to lactic acidosis. There's another side effect tied to metformin that could also be affecting your health in ways you might not even realize. It might not be as life-threatening as lactic acidosis, but it's still something that you need to take seriously. If you're finding this helpful so far, please take a second to like this video. It may seem small, but it tells YouTube that this message matters and helps Knowhow reach more people who truly need it. If you believe others deserve this knowledge too, tap that thumbs up now. Have you ever noticed a sudden loss of energy or felt like your strength just wasn't what it used to be? It can be frustrating when you're doing everything right, eating healthy, exercising, and trying to manage your diabetes as best you can. But still, there's this nagging feeling that something isn't quite right. You may even notice it in simple tasks, like climbing a set of stairs or carrying groceries. Things that should feel easy, but now seem so much harder. What if I told you that this isn't just a normal part of living with diabetes? What if this could be a silent side effect of the very medication you've been relying on to control your blood sugar? It's something that affects many people, but it's rarely talked about. And over time, it can have serious consequences on your physical health. This side effect isn't something that happens overnight, but it slowly builds up until it starts taking its toll. Metformin, one of the most commonly prescribed medications for diabetes management, can contribute to muscle weakness. You might be asking, how could my diabetes medication possibly be affecting my muscles? The answer lies in the way metformin interacts with your body's cells and its ability to provide energy to your muscles. This silent side effect might not be immediately obvious, but it's one that can seriously impact your quality of life. It's not unusual to feel tired or sluggish from time to time, especially with the stress that managing diabetes brings. But if you're on metformin, and those feelings of weakness persist or become more intense, it could be the drug interfering with your muscle health. How does this happen? The science behind it is more subtle than you might think. Metformin affects mitochondrial function within your cells. Mitochondria are the energy powerhouses of the cells, responsible for producing the energy your muscles need to function properly. When metformin disrupts this process, it leads to muscle weakness and a general decline in endurance over time. This disruption isn't always obvious, and the effects can be gradual, so it's easy to dismiss it as a result of other factors, like aging or stress. However, research shows that metformin can contribute to a noticeable decline in muscle strength, especially after long-term use. A study published in the Journal of Clinical Endocrinology and Metabolism revealed that patients who had been using metformin for an extended period of time experienced a decline in muscle mass and strength. The research showed that these individuals often lost muscle mass without realizing it. The problem is, by the time you notice it, your muscles may already be weaker, which means it becomes harder to rebuild that strength once it's lost. For many, this becomes an ongoing issue that affects their daily lives. Tasks that were once easy become more difficult, and they might even find themselves feeling fatigued after short bouts of activity. It's not just about feeling tired. It's about losing the strength and endurance to live your life fully. What's even more concerning is the domino effect muscle weakness can have on other areas of your health. Muscle weakness doesn't just stay confined to your muscles. It can affect your balance and mobility, too. As your muscles become weaker, you may start to struggle with basic movements, like bending down, picking things up, or even walking for long periods. These issues might seem small at first, but they can gradually become a major problem. And let's not forget that muscle weakness can increase your risk of falls and injuries, particularly for those who already have difficulty moving around. But don't think this is something that just happens to a select few. The reality is that this side effect of metformin is far more common than most people realize. In fact, a study in the Journal of Diabetes and Metabolic Disorders found that muscle weakness is a frequent concern for those on long-term metformin therapy. The medication slowly chips away at muscle strength, and without intervention, these small changes can add up, leading to more significant challenges down the road. The issue is, it's often hard to pinpoint the cause. Many people attribute their loss of strength to other factors, such as getting older or managing diabetes itself. But it's possible that metformin is playing a much bigger role in this decline than most people know. So what can you do about it? The good news is that muscle weakness caused by metformin can be managed and even reversed. The key is to be proactive. If you've been on metformin for a while and have noticed a decline in muscle strength or endurance, it's important to talk to your doctor. Don't just accept it as a natural part of diabetes management. There are alternative medications or dosage adjustments that could help reduce these side effects. Your doctor may recommend lowering your metformin dose or switching to an extended-release form of the medication, which is often gentler on the body and less likely to cause muscle weakness. In addition to adjusting your medication, there's another simple and effective way to combat muscle weakness: regular exercise. Strength training is essential for preserving muscle mass, and it can help rebuild what has been lost. Resistance exercises, such as lifting weights, using resistance bands, or even bodyweight exercises, are incredibly effective at building muscle and restoring strength. What's more, these exercises can be done at home or in a gym, making them accessible for nearly everyone. If you're unsure where to start, consider working with a physical therapist or personal trainer who can help you develop a safe and effective plan. Strength training isn't just about building muscle. It's also about improving your overall health and well-being. As your muscle mass increases, your body will become more efficient at burning calories, which can help with weight management. You'll also notice an improvement in your balance and coordination, which will lower your risk of falls. If this video was helpful, please don't leave without subscribing to Knowhow. And if you feel like I truly understood your struggle and offered a solution that matters, type the word relief in the comments. I'd love to know if this helped you.